Hello, happy sunny Friday. I hope you're well. I am excited to be live today. I am going to be chatting with the lovely Anna and Tracey all about pessaries. And yeah, we've got lots to cover. So I know Anna is here and hopefully Tracey will be here. Anna in, so let's see. It's always a testing moment. And hopefully Tracey will join us soon. There she is. Hello.
Hello, hi, how are you?
I'm good, I'm good. Happy Friday, sunny Friday.
Happy sunny Friday.
I
Thank you
can't.
to anyone that's joining on a sunny lunchtime.
I know, yeah. It's warm, it's nice. Let me just see. I'll invite Tracey and then hopefully the minute she's here, she will join us. Um, I was just introducing you, but I'll let you introduce yourself while we wait for Tracey to arrive and then hopefully it'll all come together.
Absolutely. So, for those of you that don't know me, I'm Anna. I'm a GP by background, really passionate about women's health. I'm very interested in the menopause. I'm very interested in postpartum care. And I have the pleasure of working with both Clare and Tracey at Westminster Women's Clinic. And so we have a beautiful multidisciplinary team where we can support women across all phases of life with all different issues. But for the purpose of today, we're going to be talking about pelvic organ prolapse and the role of pessaries. So I can perhaps, whilst we're waiting for Tracey to join, I can perhaps
Yeah.
give a bit of context because we know that sometimes IT can be tricky. Let's first start by talking about what a pelvic organ prolapse is. So this is when an organ prolapse is when the muscles and tissues that support the pelvic organs, so the bladder, the uterus, and the rectum, become weakened and stretched. And Claire's got a lovely example there. And so as a result, because we lose the support, or we don't necessarily lose it, but it's weakened, some of these organs can potentially descend into the vagina, and this can lead to symptoms such as bulging, pressure, or discomfort. You might feel or be aware of a fullness within the vagina. Now, depending on which of those organs has descended down, you can get different sorts of symptoms. So, for example, if it's the bladder descending into the vagina, you can get urinary symptoms. This can lead to symptoms like leaking or urgency. You might have difficulty emptying your bladder. Quite a lot of women describe feeling like they need to go immediately after they've just passed urine.
Yeah.
If
Or a
it's a
dribble. Or
or
a
a little
dribble
dribble,
afterwards.
exactly, yeah. If it's a bowel issue, if it's the bowel that's descending into the vagina, then you can get things like constipation or difficulty with bowel movements. Sometimes you might get musculoskeletal symptoms. So sometimes women can describe an achiness or a backache. Occasionally it's a feeling like you're sitting on a ball, or it can cause sexual dysfunction, can't it, Claire? You can have discomfort during sex. I think the key message is that this is really common, and despite it being so common, we're still not very good at talking about it, talking
Yes.
to our healthcare providers about it. And I think the statistic is that 1 in 2 of us will get a degree of pelvic organ prolapse across our lives. There are some times which are higher risk. So we at the clinic support a lot of women postpartum who perhaps through a vaginal delivery or just through the pregnancy itself might have had a strain on their pelvic floor or actually had some pelvic floor trauma, and that in itself can weaken the muscles and the supporting structures and give rise to prolapse symptoms. We also look after women as they age, and particularly as they go through their menopause. And due to the lack of estrogen in the tissues during this time, this can also affect some of those supporting structure, and prolapse symptoms can start to manifest. So there's lots of, I think the important thing is not to suffer in silence, because there is loads and loads of help available.
Yeah.
And through the help of wonderful specialist pelvic health physiotherapists, you can have a range of different treatment options, from working on your pelvic floor to pessaries, which is what we'll be talking about in more detail today. What we're going to do actually is try and do this in 2 sessions, because I think when we were talking about how we might structure this, we realised that there is just so much to talk about. So today will be a bit of an overview. We will do a quick demonstration of what a pessary looks like, but actually there are so many different options available, dependent on your needs. And so we'll do a part 2 where we go into the detail of the different pessaries available. I think one of the beautiful things about our clinic is that we have all of those different pessaries available. We are a specialist pessary fitting service. So even I, was quite surprised to understand how many there are available. So we can give you a few examples today, but we'll do that as a part 2. Hi Tracey,
Hi,
welcome. do
morning.
you want to introduce yourself for those of us that don't?
Yeah. So I'm Tracey Matthews. I'm pelvic health specialist in Westminster Women's. My specialism, I love treat everything, but my specialism is prolapse and pessary fittings.
Brilliant. Great. So hopefully we're going to have a great discussion and cover lots of information today. Claire, I wonder if you can kick off the discussion. Could you tell us what is a pessary and what's it used for?
Yeah, absolutely. So a pessary is a small device that we use to support the vaginal tissue. So obviously you've given the overview of what prolapse is. I think the way Tracey and I would sort of describe it and talk about it is to simplify things. This is what I always talk about in clinic. The vaginal tissues, there's like a front wall and there's a back wall and there's a top. Think about it like that, okay? And it's those walls that move positions. They will sit lower. It could be 1, it could be 2, it could be 3, it could be a whole host of different things. Essentially what a pessary is aiming to do is to go in and support those walls in some way, shape or form to improve your symptoms. So we're not trying to fix the prolapse by fitting a pessary. It is a way of supporting you in your day-to-day life as well as improving your symptoms. So we would always use it in collaboration with your pelvic floor muscle training and getting you active and sorting out bladder symptoms. And if you've got bowel constipation symptoms or you're straining, like it has to be a holistic full body picture. But a pessary is something that we can use. And as you said, there's lots of types. Sometimes how we talk about it is imagine it's a bit like a sports bra internally, in the same way that generally as we go through life, maybe if we've had children, maybe if we've breastfed, our breast tissue is no longer as supportive or as strong, and we need a really good sports bra. We would think about it in the same way. So it's kind of, if you're trying to visualize it, it's a supporting structure. They can stay in, they can come out. There's lots of options, but that's the kind of overall concept of them.
Amazing. And Tracey, I don't know if you've got your
I've got loads.
pessaries to show. We won't go
Got
into
a
loads of
whole
details.
array. So there's two kind of like, I class them as two types of categories really. There's the temporary, which is like off the shelf pessaries that you can buy, which are like your contams. So if you've seen that box, you can buy those. They're either square or they come like tampon, and you soak these, and they're one single use. And generally, there's a new one potentially coming out, but it's not come out quite yet. And then there's your contiform, yeah, and it's more for stress urinary incontinence rather than prolapse, but it's still, I kind of like, part of me wishes they would make something a bit more permanent with this, because it'd be great for rectoseals, you see, because rectoseals are the problem. And then this is classed as a pessary as well. In the sense it's kind of against single use. And then you go into the more kind of like longer term lasting pessaries. So they're made of medical silicone, and they're either in a ring shape, or can be PVC, which is quite hard, which is generally the one on the NHS that you kind of then get. This looks like a donut. The ones that tend to be the most popular are kind of cube, yeah, and the ringed pessaries. But at Westminster Women's, we have a whole array of different pessaries. So if you've got prolapse and vaginal wall, you then get what's called a cult incontinence. So you've got a pessary that can support the urethra but also support the descent of the tissues, and they are in different sizes, different knob sizes as it's called. But there's lots, and then there's your shelf as well. So that's another one. And Gelhorn, I'll show you the Gelhorn, otherwise we'll be like, that's the Gelhorn,
Yeah,
which
there's
looks
so
like a bit
many
like a
available.
doorknob.
Yeah. I think the key
So
is that
many.
these can be really individualized to specific needs. So whatever you're struggling with, there's normally a solution, and that can be fitted specifically for you, can't it?
Yeah,
So
absolutely.
and just to you use the word rectoseal there, just for those of us that might not know what rectoseal is, would you just quickly be able to tell us that terminology?
Yeah, of course. I mean, that terminology is now old terminology. We've gone away from it because, as Claire says, it's the posterior wall that is descending down. But there's still literature out there, and everyone who comes in generally says, I've got a rectocele. So, a rectocele is the wall that supports the bowel, basically, and that can descend down various different reasons: childbirth, constipation, straining, coughing, all of that. And that they tend to sit a bit lower than where the pelvic floor and where the pubic bone is. So they tend to be symptomatic in a way, and they're harder for a pessary to fit. But generally, there are some pessaries that you can use that have got kind of like the pessaries that have got a wider surface area. So like the cubes, like your donuts, they kind of, you want to hope that they kind of lift that back wall tissue to help with support and take away symptoms. But to be fair, if you keep your bowel regular and consistent, they generally are the types of prolapses that are easier to manage.
Yeah, exactly. So there's lots of lifestyle adaptations that you can do that can help. Let's talk through the process. So let's say I feel I'm concerned that I could have a prolapse. What would that process be, Claire? Say I came to see you. What could you talk me through that process so that women can know what to expect?
Absolutely. So yeah, so we'd always have a long chat. You know, I think what's really important for us to acknowledge is when you feel like something's potentially falling out of yourself, or you have symptoms you don't understand, it can feel really emotional and quite scary. And we just want to create a space for you to feel safe to come and talk about that. Also, a lot of women may have been through the system for a very long time and maybe don't feel heard, or maybe have been given advice which has made them quite scared to move. So that's something that we'll explore with you. Then we'll do a physical assessment. So, I mean, I would always start with looking at breathing and looking at the tummy and looking at any scarring and trying to understand the whole of you as part of that before we would do a vaginal examination with your consent. If you're happy for us to do that, most women are more than happy because they're like, I want to know what's going on. We may or may not use a speculum. We will generally get you lying down. We will generally get you standing up so we can understand, because I know Tracey will echo this, but you know, we do a lot of medical examinations in lying. Most women are symptomatic of a prolapse not lying down, because really that takes the stretch off the tissues. Now, there are ways that we can do to test for those tissue changes, but a lot of women, I'm like, I can see what you're saying, but I don't necessarily exactly understand. And the minute you stand them up, there is a change of presentation, which really helps us to understand what you are feeling. So though it feels a very different examination, we get you standing and we look, we'll maybe use a mirror, we'll examine. I work that as well. And then we'll talk you through what we found to try and make sense. And then we would talk through management options. Pessary may be one of them.
So it's really important, is it, to get the right size of pessary, because otherwise you can get some troublesome symptoms. Could you just talk us through, Claire, how you would size a pessary? What would that look like?
Yeah, so I mean, generally, depending on the pessary, depends on how we fit them in. So personally, I fit cubes and rings. Tracey does everything, so that's where we're slightly different in our management. Tracey's been fitting pessaries longer than I have, but we generally are looking at, with our fingers, we are measuring internally about where the vaginal walls are, looking at the size of the opening of the vagina to work out, like, first of all, what can we fit in and what's going to be comfortable for you, what's going to provide adequate support. We use a speculum to look at the health of your tissues. So as you've mentioned, it has to fit right, but equally we need the tissues to be healthy enough to sort of receive a pessary and tolerate a pessary, because anytime something is, if you imagine a bra and you just wear it day in, day out, day in, day out, and it keeps moving on the same bit of tissue, you can get a rubbing sensation. Or if you go for a run, we can get those rubbing marks. So imagine that internally. If there's something that fits but maybe not correctly, or the tissues are not healthy enough, it can cause rubbing and irritation. So this is where we need to look at the tissues, make sure everything's healthy, to make sure, do we also need a bit of medication alongside that, which maybe is like a vaginal estrogen, which we work with Anna for, because we need a doctor to prescribe that. And that's all the sort of stuff that we're looking for. But what I would say is it's not a painful process. Like, just to reassure you, Tracey and I, in order to learn this, have had to have this done on ourselves. So we have been through what we would ever do within clinic. And so we know it's not painful. None of it is pleasant. You know, I think we'd all agree that any gynecological examination doesn't feel like the best thing we want to do on a Friday morning, for example. But it's not a painful process. And I think that to hopefully reassure anyone who's maybe a bit nervous about it or the concept.
So I think just a point on that, quite a lot of women will ask, well, will I be aware of it being in there? Is it going to feel uncomfortable? What would you advise in response to that?
A good fitting pessary you should not know about, in the same way that if a tampon is in the correct place, you carry on your life forgetting you've got a tampon in. It's the same thing. So if it does feel uncomfortable, it's not the right fitting, or it's slipped, or it's not in the right position, and we need to address that with you.
Thank you. So once it's in, Tracey, how long can it stay in for? How long does it need to be reassessed?
Yeah, so if we're talking putting aside the sort of off-the-shelf pessaries, just talking about the silicone ones, there's different ones, but we'll just talk about the rings and the cubes. So generally rings can stay in for up to 6 months at a time, and some women prefer that because they just want to pop it in and they just want to leave it. And there is research around leaving it in helps support the tissues, okay, over a longer term, but it does have to come out on a regular. I teach all my patients, myself and Claire teach all our patients to self-manage, but there might be some patients who just don't have that dexterity to be able to take it out independently. So they will then come back to clinic and they will have it changed every either 3 to 6 months. Generally in the first year, I get people back a bit more regularly, like 4 times in the year, just to check. And that's just generally the ring. The cube's a bit more straightforward. It's self-managing. So it has to come in and out, nice guidelines, by every single day. Okay, so it has to go in and out. And this is great for mums who are just, or not even mums, women who are just kind of symptomatic on an intermittent basis, or they want some support when they're exercising. So generally pessaries, medical silicone pessaries, last 5 years, but I recommend changing them every 12 to 24 months, but as in staying in place. A ring 6 months, a cube has to come out daily.
Are there any risks if you forget about your appointment, leave it in too long? Can you get infections? Can it rub? What are the potential concerns?
Yeah, so one of the things when we're assessing kind of contraindications for pessary fitting is, are you going to come back for regular accountability? So we can check, like Claire said, they check those tissues. At the end of the day, it's a silicone device going into a soft against vaginal tissue. And if you leave it in too long, it will rub, it can wear away if you're not keeping on top of your vaginal estrogen, or whichever method, whether it's a lubrication, vaginal moisturizer, or if you're using something else, other alternative. If you're not keeping on top of that, you will get rubbing and you can get erosions, and then that can become infected and become a problem. But generally, pessaries do not cause infection. Okay, these are Profem ones from Pioneer Medical, and they can be sterilized if you're using them at home. So if they come out with a bowel movement, if you've got constipation and they come out with a bowel movement, or you're adjusting it, because sometimes you do have to adjust it, and you're over the toilet and you drop it in the toilet, you can then sterilize them. Okay, but the vagina is not a sterile environment. However, we don't want to introduce anything. You wouldn't want to introduce anything sort of like feces or any bacteria within there. But actually, pessaries themselves do not cause infections. The problem is if you leave it in and neglect it too long, then you will get abrasions and rubbing, changes in pH, which can lead to infection.
Okay, that's really helpful. Thank you. I wondered if I can put some commonly asked questions to both of you, and I think we've got a couple of questions in the chat as well.
I'll have a look.
So one of the most common questions, Claire, is can I have sex with a pessary, and do I need to take it out and put it back in?
Yeah, great question. And this is something we very much talk about with women in clinic. This is all why we need to get to know you better, because we need to understand, do you want to, do you not want to? So essentially the rings that can be left in, you are able to be sexually active with those. The ones that are space occupying, sort of, for example, the cube, would need to come out. So it really depends on the type of pessary that's indicated for you. And that's why we believe in self-management being really important, so that women can feel empowered to, in the same way that you put tampons in and out, or you learn how to use other things in your gynecological health, maybe like a moon cup or a disc or whatever it might be. We want you to feel confident so that you have all the options available to you, and it doesn't need to be a barrier to your intimate life as well. So yes and no, depending, but we want to make sure you can, and we'll have a good old chat about that with you so you feel confident.
I get a lot of questions from postpartum women about pessaries. So one of the questions is, how soon can I be fitted with a pessary postpartum? I think that's in response to tissue healing. But also, will it will it in any way prevent my own pelvic floor muscles from activating? Will they get lazy if it's in? Tracey, would you mind answering that one?
So these are my group of women that I love, because especially if they've got multiple children, I think and there's any signs of kind of laxity within the vaginal walls and they're running around after little ones, I would like to get something in there to kind of support those tissues like a sports bra. Um, we have to, like you said, if they're breastfeeding, look again at the tissue health and have a look at the tissue health. But generally, it's 6 weeks is probably the earliest. But to be honest, that's when women see me for an examination, and I wouldn't necessarily fit a pessary straight away after 6 weeks. It'd be a discussion. It'd be what's their activity levels like, what support have they got at home, and basically what I'd look at the whole scenario before we went straight on. You need a pessary, but there is emerging research now saying that to help support those tissues to heal while we're in such a big hormonal change, that pessaries have been proven to help symptoms and to help the remodeling, I suppose, of the connective tissue while there's so much hormone changing going on with the collagen.
Amazing. So lots of options available for postpartum mums. One of the other questions, Claire, was, will my pessary slip out when I'm on my period?
If it's fitting right, no, it shouldn't. You can use pessaries on your period in the sense that there's a ring there, it would carry on being there, and you would, all of them, even if they've kind of got an occluded area, I guess a more solid area, there are holes to allow period blood to move through, like this. And the cubes do. There are some solid cubes, but there are some that don't. So again, that's something that we would discuss with you, because some people maybe don't have a point of life where they don't have periods, and if they do, but yes, there you go, you see the little holes, and some that don't. So yes, absolutely you can. I guess one thing that I think of in the more menstrual health area is coils, because obviously if you've got a coil in and you're taking something in and out, this can be tricky, because we want to make sure that by taking things in and out, we're not dislodging your contraception. Now again, it depends what you're using that coil for, so I'll let Tracey maybe explore that a little bit more, but that's something that we need to consider on the period chat, is that lots more women are having coils, and actually it can make other parts of management a slight little bit trickier.
Yeah, I mean, you can wear a pessary with a coil. It just depends on if the pessary is for uterine descent, his cervix, how close the cervix is to the pessary. But also if we just liaise with the GP to see if we can cut the strings a little bit shorter. But generally, there's no problem. It's not. You've got to remember, a pessary is not a sanitary device. So even if it's got a middle in, yeah, it's not like a menstrual cup. So you will have to wear. So you can wear it on your period, but you will have to wear like a sanitary towel or the underwear, the period pants along with it, because it won't stop it won't stop the bleed.
We've got a question on the chat, Claire. I had my bladder removed in January and I had a urostomy stoma. I now have constant lower back pain and a heavy sensation where my bladder was. I'm assuming she means in the vagina. The question was, could this be my bowel that's moved?
I mean, it could be a lot of things that moves. I think this is where it's really important to understand that whenever we do surgery within the abdomen, whether that's a C-section, a removal of an organ, we create scar tissue and things do move. It could be adhesions that you're almost feeling. So adhesions are like sticky scar tissue. In essence, the way everything's very packed within the pelvis. I know we look at diagrams and it looks like your bladder's somewhere over there and your womb's up here and your bowel's way over there, but actually they're all really closely connected and they all have the same ligamentous structure. So removing part of that, it could be that your womb has moved slightly, that the bowel has also moved, because there is a space, in essence, there's a bit of space there. It would be hard to say, and they probably wouldn't know unless they looked at loads of scans. I'd probably encourage an assessment of some form to see if there was anything that we could do. And again, there would be a lot more questions than I would probably have answers for at the minute, like what's your bowel habits like? Are these other things? But I'd say there's probably a lot of scarring that could be contributing to that. But again, you would still be someone that we could support. It would just be needing to know more about the story. It wouldn't be possible to be so definitive about what is exactly causing that.
So a good assessment initially is needed.
Always. I mean,
Yeah.
everything comes from assessment. You know, that's why we always say the first hour is one of our most
Mm-hmm.
important things. And that's why we ask you so many questions. You're probably thinking, here they go again. But actually, we as clinicians make so much of our understanding and thought processes of how to do the next steps by what we ask you. And that helps us really make sense. And I always say to women, like some women are where things have been going on for many, many years. We have to be detectives over many, many sessions sometimes. And the way I think Trace and I approach it, you sort of test, retest. Even with pessaries, there isn't like one solution. And sometimes we've fitted one thing thinking, yeah, that'll work. And it really doesn't. And you're like, that is so not what I imagined. We try something different. So just because something doesn't work doesn't mean it actually tells us more information, which we then use to inform more decision making. And that's the sort of way it works.
And that's why our appointments are 90 minutes, because it's finding out where to fit a pessary well. It's like, where is the support needed? So where is that support needed? And that's why we spend so long, get down, stand up, go for a walk, go up and down the stairs.
Go to the toilet, come back. You know, we really want
what's
to be
so lovely about our clinic as well, is this multidisciplinary talking. So quite often, you know, you particularly when you work in private practice, you might be quite blindsided to other things because you're working in silo. Whereas here, we're very much talking to each other. So if something isn't quite right, and we're wondering, is there something else going on with the bowels here? Could there something else be going on with the bladder? Do we need to think about menopausal vaginal tissues? You know, we can all knock on each other's door and come and ask, and also get a second opinion. So it's been one of the biggest pleasures of working both of you, that we're able to sort of support in that holistic way.
Yeah, absolutely.
I think we're coming to the end now, but I wondered if I could ask both of you for just a final message to women who might be considering pessaries. Claire, what would you say is an important message?
Pessaries are not just for older women. That is something that 100% like is still misunderstood, in the same way that a sports bra isn't for anyone over 50. Like, it's just been misconception. Also, a pessary is not a final solution. It can be part of any solution. There's just a question here of how can I get in contact with the clinic. What I'll do is I'll put the email here, and we have lots of information that we can just send out to you, read it, and you can get in touch. So I'll put the email address here below.
And Tracey, your final message?
Yeah, similar to Claire's really. I mean, there's lots of things that we can do. And even if you've been to the NHS and you've tried, not just the NHS, but been somewhere else to try lots of different pessaries, it might be that you come in and we can find something else. So there's a combination of things that we can do together. The one thing I would say with pessaries is you still need to do your pelvic floor strength, because pessaries aren't, a lot of people think it's just like a plug and it helps lift everything up and stay there, but it's not, because it needs that support of a good pelvic floor muscle bulk to stay in. But there are other pessaries that we can, if your pelvic floor is not quite there are other pessaries that we can use that are more supportive. So just basically get in contact.
Yeah.
Brilliant. Well, thank you so much for tuning in, and we'll put this on the grid so you can watch it at another time as well. Stay tuned for part 2, where we'll just be going through pessaries in much more detail and doing a real show and tell of all of the wonderful options
Row them
available.
all over.
Yes.
These are not the ones she fits in clinic, guys. These are demos.
I've got so many demos.
Thank you both, and I'm sure I'll see you both next week.
Yeah.
Take
Take care,
care.
guys.
Bye bye.
Bye.